Testing should really be based on exposure. We don't recommend people to just get tested all the time.
Director of Public Health Katherine Wells explains when to be tested for the coronavirus. Good evening and thanks so much for choosing KLBK News. I'm Terry Furman. It's only the beginning of the holiday season and Lubbock health experts reminding us to have a safe and socially distant Thanksgiving. But in the event that you may have been exposed to the virus, KLBK's Allysa Tellez spoke to the Lubbock Health Department about when to be tested. Allysa, what is the amount of time to wait before you get tests?
Terry, health experts say to at least wait 5 days before going to get tested for coronavirus, saying results may not show up until later on.
You may still have plenty of leftovers from the past Thanksgiving dinner, but there's one we hope we don't walk away with, and that's the coronavirus.
If you had an exposure, or if you were at an event and somebody notified you that there was a positive at the event, then that warrants getting tested.
Director of Public Health for the City of Lubbock, Katherine Wells, says to wait 5 days before getting a test and to spend that time waiting in isolation. But a negative test doesn't put you in the clear.
You need to isolate, stay away from others for at least 14 days. And that's because it can take up to 14 days to actually develop COVID symptoms and test positive.
We saw a spike in cases after 4th of July and Labor Day, but Wells says it's hard to say what exactly will happen in a few weeks.
People were interacting and moving around and meeting with each other, and every time that's happened with this pandemic, we have seen increases.
Due to testing sites being closed on Thursday and Friday, we should also expect to see a drop in cases the next few days.
I don't want people to think that means everything's okay, but I do anticipate a drop and then that to increase once we start getting those numbers in from testing that's occurring today.
Because this is only the beginning of a very different holiday season, and with hospitals already reaching capacity.
We all have to make sacrifices right now and really stay the course.